The Eleanor Duncan Aboriginal Medical Service provides a range of health and welfare services to the community of Central Coast. We are auspiced by a Yarran Aboriginal Health Service, and we cater for the health and wellbeing needs of the Aboriginal community in a holistic manner. The centre is named after Eleanor Duncan, who was a well-respected and well-known Aboriginal elder of the community, who was also a registered nurse here on the Central Coast.
Hi, how are you?
Good, thank you. I'll hand the third mic.
Yep. Hi, Mike.
The Eleanor Duncan Aboriginal Medical Service was set up in 1995. Our clients come to our health centre because it's a safe environment, it's culturally appropriate, where we meet the needs of the Aboriginal community, and we also support clients to services outside of our organisation.
Very good. All right, to come have a seat.
All right, thanks.
How are you today?
Not too bad, mate. Thanks.
We are an accredited medical practice where we provide primary healthcare services, including health checks for both adults and children, chronic disease management plans and mental health care plans, and a number of programs like the Hearing Health program.
Okay, so you've got a fair bit of flexibility there, which is good.
Yeah.
Hello, what's your name? Bailey, that's a lovely name.
We have a family health program which deals with family violence and sexual assault, a drug and alcohol program, a mothers and babies program, an Aboriginal outreach worker, a health promotions officer, and of course our oral health program.
No worries. Cheers.
We have a number of visiting specialists, which include the psychiatry team that comes 3 days a week from the Wyong Hospital. We have a paediatrician who comes once a month, a dietitian who comes once a month, a diabetes educator, a well liver clinic, a podiatrist, a physiotherapist, a speech pathologist, and an optometrist.
Now, I'd like you to see if you can read this bottom line to me. Just read those letters out aloud.
FDNTUHPX.
Excellent.
All of our health services are provided in-house at the medical centre, except for the oral health program, which is an innovative approach providing dental services externally at the Wyong and Gosford Hospitals dental clinics, where we work in partnership with the Central Coast Local Health District.
Like I said before, Ali, no pain at all.
No.
Our dental service is mainly targeted at providing oral health care to low-income earners who don't hold a healthcare card or a pension card, so therefore find it difficult to afford to go to a private dentist.
So we open up really big. We do 10 scrubs back and forward.
If our clients have children, we try to organise the children to see a child oral health therapist on the same night, and that way the whole family get to go at the same time. Our organisation is funded primarily by Department of Health and Ageing and OATSI and New South Wales Ministry of Health. However, our dental program is funded by the Centre for Oral Health Strategy, also New South Wales Ministry of Health, and we receive funding from FAXIA. We are also a member of the Aboriginal Health and Medical Research Council of New South Wales, in which we are one of 52 AMSs in our state and one of over 150 AMSs nationally. Our oral health program complements the rest of the programs that we provide the community in making sure we are providing quality, holistic healthcare to our community on the Central Coast. Our oral health coordinator, Karen Thu, is the first point of contact for our oral health program.
Hi Liz, how are you today?
Good.
I heard you're having a bit of problem with your teeth and you need to see the dentist.
Yep.
Now you're already a patient here at Eleanor Duncan. You see our doctors here, don't you?
Yes.
All right. So you don't have a healthcare card or pension concession card?
No, I don't.
No. Well, you're eligible for our program, for our Wednesday evening and Thursday evening programs. So I'm just going to check you're here on our system. Yep, you're on our system here. My role in the oral health program is to actually as a patient flow coordinator. So I actually ring patients and patients come in to see me. I actually do referrals for them and I actually fax referrals off to the call centre. Then I let the patients know they have to call the call centre to make their appointments and to register with them. Hi Joe, Karen here from Eleanor Duncan, how are you? Oh, that's good. I'm just ringing to let you know that I can actually get you into the clinic this evening at 6 o'clock. Yes, I actually confirm patients' appointments at both clinics, Wyong and Gosford. In 2011, I did about 300 referrals for patients at just Wyong Clinic. This year so far, I've done over 200 referrals as well for both clinics. I also support the patients at the clinics to make them feel more comfortable that they've got a person that they know. Hi Cherie, how are you going? Good? Oh, that's good. You've got an appointment tonight with Baishi, so I'll hand you over to Nicole and Nicole will book you in. Within the oral health program, we have set up a number of partnerships. One of the partnerships we have developed here is with a private practice up here in Wyong, and that's who we refer our emergency patients to. Hi Megan, it's Karen here from Eleanor Duncan. How are you? I have a patient here that has a bit of an emergency. They're having a problem with one of their back teeth. His name is Mr. Craig Wilson. I was wondering if I could send him up to see you this afternoon sometime.
Okay, I can fit him in at 4 o'clock this afternoon if you like.
Oh, that time would be perfect. Okay, yes, I'll make sure he brings his referral with him when he comes.
Welcome to Wyong Dental. You're from Eleanor Duncan? Fantastic. I just get you to fill in a new patient form and take a seat.
We've also set up another partnership with a local denture clinic here in Wyong, who actually does our curing mouth guards for our children who play football, and he also does dentures for our patients.
This is a voucher so you can get a new denture made, all right? So you need to contact the procedurist in question who do the work for the Eleanor Duncan scheme, all right?
Thank you very
Very
much.
painless today for you.
It is. We've also developed another partnership with an oral surgeon who is in Gosford, and the dentists at both Wyong and Gosford clinics refer our patients to this surgeon. I spend 2 days a week in the office, Mondays and Tuesdays, and then I spend Wednesdays and Thursdays at the clinics. We have 2 clinics because it's a lot better and it's easier access for our patients. If you lived south to get to Wyong Clinic, you would have had to travel an hour to get to the clinic, but now we have our Gosford Clinic. It cuts down that time for the patients. Since we have both clinics running, the fail attend rate and the unable to attend rate has dropped immensely. One of the most important things about the program is it's very family orientated. Parents actually come to the clinic and their children attend as well. Parents might see people in the waiting room they haven't seen for a long time, so they'll all have a little yarn. It's a very community-inspired program. So I'm really busy tonight. As usual, our Wyong Dental Clinic, we have Lauren in here, our hygienist, who's doing a wonderful job. And this is where our dentist, Vaishi, works. She's doing root canal therapy tonight. Hi, Vaish, how are you going?
Not too bad.
How much longer do you think you'll have with this patient?
Probably another 5 minutes. We're just waiting for the x-rays to come through.
Okay, and Cherie's doing fine, you right, Cherie? Yeah. Oh, that's good. All right, so about another 5 minutes, Vaish?
Yeah.
Okay, no worries. Let your next patient know. Okay?
Yeah, thank you.
Thank you.
This is a big tooth like what you've got. You want to make sure you don't get any holes in them. Do you remember what's not good to eat?
Lollies.
Lollies and sugar.
Another therapist here, working on some more children, doing a talk on oral hygiene. That's really good. Patients seem to be very content when I'm here. They seem relaxed.
Statistics show that Aboriginal people suffer, along with all other health problems, poor oral health, and that's to do with access to services. Most of the cases that we see are to do with oral disease, so that's either dental decay or periodontal problems. Periodontal disease is all about gum disease.
Okay, because you have teeth that are very close together, it's a good idea to use some sort of floss, and a floss that would be good for you is the floss that's called super floss, because you have a retainer at the back of those bottom teeth, and the super floss is designed to feed in behind the retainer and pull through, so that'll stop those gums getting irritated just at the back there.
The education side of the program is a really big focus of both the child and adult, because dental disease, both dental decay and periodontal problems. Gum disease is a preventable disease. So while we provide a treatment service, we would really like to focus on the prevention. It's very expensive to treat dental problems. Also, periodontal disease has been linked with a lot of chronic diseases like your chronic heart conditions, diabetes, preterm low birth weight babies. So people are starting to understand the link between those now, and it's very important that if we can prevent a lot of oral diseases, that we can also reduce a lot of the risk factors that contribute to other chronic conditions.
We think it's a good idea for you to give up smoking, and being so young, it's going to really be a great benefit for you to give up now. If you give up now, in 2 years all of your organs will return to perfectly normal health.
We teach a lot of adults too how to read food labels when they're purchasing things from the supermarket, just simple things like that. We give them a little handout that they can take with them shopping, and they're able to then better understand food labelling.
A soft toothbrush is very important. It's a good idea to start at the back.
With the education, we go over oral hygiene instructions, so how people should clean their teeth.
When you get to the middle, turn the toothbrush around. Spend a little bit of time down the bottom area there on those gums, because that's where a lot of plaque will get trapped. Massaging the gums, top and bottom, all the way up to the back.
The therapists with the children give out an oral health pack, which is a toothbrush and toothpaste. We give stickers and colouring in, education pamphlets to the kids to take home, and the hygienists do that with the adults.
All right, Cherie, so this is the pack that I was talking to you about. So there's the toothpaste, mouthwash, now the toothbrush and the floss as well. So make sure you brush in the morning as well as the night time, and make sure you floss once a day as well.
The oral health pack is an important component to the program. It gives us the ability to give the patient something to take home. Some people don't have the means to go out and purchase those products, so at least we can give them a start and they know what they can purchase down the track from that.
Thank you very much.
No worries.
Hi Dr. Alec, how are you going? I'm just letting you know your next patient has arrived.
The key parts of the program really is Karen in her role. With Karen here, she follows up the patients. If people are unable to attend, she's slotting new people into that spot. We never have unable to attend because we always put people into those slots, but the failure to attend rate is really low as well.
Thanks, Ange. That was a great night tonight.
Thanks, guys.
I'll give you a call on Tuesday.
Bye.
Karen is fantastic. She rings me to make sure that I remembered my appointments, and then when I arrive, she greets me like she's very welcoming. She makes you feel very comfortable. The whole team does. They make you feel great.
Welcome everybody to our monthly meeting, our partnership meeting. I've done an agenda
Thanks, Mark.
for everybody.
Thanks, Mark.
The monthly meetings are a steering committee meeting for the Aboriginal Oral Health Program. These monthly meetings are the heart of the program. They help us to assess where we are going and how we can improve the program. People that attend are myself, Darren Barton, the Operation Manager, Karen Thu, the Dental Health Worker, Mark Spearing, who's the Manager from Oral Health, and Leanne Mullins, Dental Therapist. Just wondering about the Wisdom Teeth Oral Health Program that we are sending people to. What's happening there?
Surgeon. There's approximately 2 to 3 patients a month that we're sending to the oral surgeon now.
The partnership is very important. Without the partnership with Oral Health, we would not be able to provide this service, as we don't have the building, we don't have the capabilities of doing this.
We still need to bolster the service at Gosford with hygiene services to mirror the model of care at Wyong.
A lot of patients have actually from Gosford have actually asked to come to Wyong to see the hygienist there.
Oh, okay.
It is a very, very good partnership. Eleanor, Duncan Aboriginal Medical Services bring the patients, the clients and the culture. The hospital bring their clinicians, their staff, they bring a wealth of knowledge and they bring the facilities. Oral Health provide management skills and the setting of the program.
Leanne, the next item's NAIDOC week.
Yeah, NAIDOC week was a really good day. We actually did 103 adult assessments and 104 child assessments there on the day. You know, it gave us an opportunity to talk to them about their oral health, give out the packages.
This is a true unique partnership. No one else in the state is doing what we are doing on the coast, and I'm extremely proud of what we're doing.
That's your mouth. You think you look pretty handsome?
The program is supported by New South Wales Health and the Centre for Oral Health Strategy, as well as the local Central Coast Local Health District, because it provides an opportunity to commit services that otherwise wouldn't be provided to what is already considered to be a targeted and vulnerable group. Essentially, we are an agency or an agent that act on behalf of the Eleanor Duncan Aboriginal Medical Service in relation to the adult services. They pay us to provide that service on their behalf for the people that they see meeting the criteria that they have a need for.
So we'll just continue with our polishing.
From a local health district perspective, we don't get involved in who comes or why they come. We provide a culturally appropriate service outside of the mainstream service in the evenings, as Eleanor Duncan require. We also provide child services at the same time as the adult services running, and the Central Coast Local Health District pay for the child services and the Eleanor Duncan Aboriginal Medical Service pays for the adult services. It's a collective and cooperative process that works really well from that respect. When we first started the trial and in the early parts of the follow-on from the trial, you know, the service was quite overwhelmed with the participation rate. The number of people that were trying to access the service was quite overwhelming and difficult to cope with. The flow-on effect of that has been that we've been able to put on more clinicians and expand the service, which initially started as a trial at Wyong. That's been expanded now here to Gosford Hospital on a Thursday evening as well. And it works particularly well because we have a patient flow coordinator that's integral to the process, which is the key linkage between the management team and the actual delivery of services by the clinicians in the clinics.
Oh, and there's Rachel. Hi, Rachel.
While it's not an easy process to coordinate, at least they've had a plan in place that's been quite effective in maintaining that the appointment schedules are, wherever possible, maintained and flowed all the way through the clinic.
Just need to bring your Medicare card and a list of any medications that you may have.
Given that, you know, everybody associates the dentist with pain, the fact that we've got a high take-up rate is a really positive outcome.
Okay, excellent. You did very well. Do you have any questions about your teeth at all?
No, that's it. You've covered everything.
Okay, great.
That's great.
Excellent.
Thank you.
Nice to meet you, Crystal.
Yeah, you too.
So we'll expect to see you about this time next year.
Yes, I thought I'd be in more pain.
Oh no, we don't try and make it painful for you at all.
This dental program's great because Karen gets us blackfellas motivated and wanting to go to the dentist.
This dental program's pretty good because I can come after hours, which is good for me because I work in Sydney 6 days a week.
If I go to the Wyong clinic, it takes me an hour each way, but if I come here to Gosford, it only takes me 20 minutes each way, which is easier for me.
I've had a phobia of dentists. I'm frightened of them. And then I thought I'd better come here because I'd had some trouble with some teeth. And with Dr. Carl, I'll always come here now because, like, yeah, I'm not scared anymore.